Well, we all have doubts, but there is a very interesting thing about how a medical practitioner or a student would have doubts about his or her own diagnosis or knowledge. The way I see it, when you are in the early part of your journey, when you are medical students or probably even junior residents, there is a lot of doubt. You are not always sure that what you're thinking is exactly what is happening. But as you grow in your career, you start understanding the subject, you start realizing that if you connect the dots, you can make a diagnosis. More often than not, the diagnosis that you make is correct, and the treatment that you give, the patient responds to it. And when you reach somewhere in that period of being a senior resident or a junior consultant, you start being confident. Now, that confidence is good because it helps you to work. But well, you have to understand the medical science is a field of probabilities. It's not a science of certainty. In fact, it thrives on uncertainty. That's how the science has been developed. All modern sciences come from the ideas which are probabilistic. But it takes some time to reach there. Now, many of us don't actually reach that stage, but those of our seniors, those of the masters, where then they have crossed that early stage of being confident, when you talk to them, when you really understand that you have reached a stage that you understand the probabilities of medicine, you again come up with that same idea of uncertainty. What I mean by that is people who are not naive in their careers, who are doing excellent in their careers, the masters, if you talk to them, they are more often than not in doubt about their own diagnosis. Now, that doubt is very different. That doubt is not about being uncertain as to what they are doing is right, but it is about, are they missing something? Is there more happening over there which can be searched by doing better investigations, by taking better history, by doing better examination, or doing better research? So, which part of the career stage are you right now at? Early stage of being at doubt, middle stage of being super confident, or at the later stage where you're not in doubt about what you said, but about the completeness of what you really understand of medical sciences?